Hello, welcome to our session titled Wellness, Intervention, Development, and Peer Monitoring Classes. Our presenters are Dr. Ann Mathews from the University of Florida and Dr. Kendra Kattelmann from South Dakota State University.
How's that?
That's good, thank you. Maybe we should introduce ourselves.
Yes, thank you all for your patience and thanks for joining us today. My name is Ann Mathews. I'm an associate professor in the Department of Food Science and Human Nutrition at the University of Florida and a member of the Healthy Campus Research Consortium and was a principal investigator of the Get Fruit study, which we will use as the basis for our presentation about health promotion within a college course. Dr. Kattelmann?
I'm Kendra Kattelmann. I'm a distinguished professor at South Dakota State University, and I too am part of the multi-state group and also was an investigator on the Get Fruit. And Ann and I are going to be sharing some of the parts that we did together in the Get Fruit intervention, it was promoting wellness on campuses.
All right, so we will go ahead and get started. I'm going to give you a little bit of background about the Get Fruit projects and set the stage so that it makes sense, a little bit of sense of how this was organized. So Get Fruit, which stands for Get Your Fruits and Vegetables Education, was a USDA-funded 5-year grant, multi-institutional grant, so there were 8 universities involved, that sought to improve the nutrition and other health behaviors of college freshmen. This was an integrated grant, meaning it combined teaching, research, and extension all within itself. And I wanted to start there because I think it's important to know the resources that came along with the grant this large, and we can talk about maybe some ways to do these types of activities on a smaller scale without such great support that we had throughout this project. So first, again, I mentioned there were 8 universities essentially in the first year of the project: University of Tennessee, South Dakota State, University of Florida, and West Virginia. All were active intervention sites, meaning we were recruiting participants, conducting these classes, and doing activities. We also had 4 universities that were serving as our comparison groups: Auburn, Kansas State, University of Maine, and Syracuse. And we had a number of consultants and collaborators at other universities that were in particular really instrumental in providing the extension support and outreach. Now, what we'll talk about in this session really are 2 courses that the 4 intervention sites developed and conducted in preparation and then in conducting the actual health promotion intervention on our campuses. So again, this was a research, extension, and education project that spanned over 5 years period of time. These classes really carried on for the first 2 years, and then there were other aims of the study beyond that. The research here, there's, if you're interested, a number of different integrated AFREs from USDA that allow and really provide the framework and the resources for conducting integrated projects. And not all integrated projects have to have all 3, research, education, and extension, but potentially 2. This conference, for example, is a conference grant from AFRE. So education, from the USDA, education typically means a formal classroom or laboratory experience. So it is formal training of the next generation of health educators, food systems experts, whatever it might be. So training bachelor's, graduate students, or potentially even K through 12 teachers, for instance. And then the extension component in an integrated project generally connects to the research question and provides dissemination of information from the different projects, informal or learning activities, so outside of a classroom experience, incorporating science-based teaching and learning techniques, for instance. So here you can see some of the students at the University of Florida that were participating in an outreach learning activity on campus about healthy eating. This entire project was really rooted in community-based participatory research. And it's a struggle, to do true CBPR and having a framework and idea when you submit a grant, but also be willing then to listen to the members of your community and let the project develop based on the input from the community. And here we really worked hard, and it worked very well, I think, having so many, 8 different universities working together, that we could kind of keep each other in check to make sure that we were truly listening to our students, essentially our university communities, and working hard to make sure that we were listening and incorporating their input throughout the project and really letting them lead as appropriate. So today we're going to talk a little bit more about those courses, how they developed, how we use CBPR in developing those courses, and then I'll turn it over to Dr. Kattelmann to talk about some of the outputs from this. Feel free to put questions in the chat or the Q&A as we go, and we'd be happy to address as we go. So again, Get Fruit Project, its ultimate goals were to improve nutrition behaviors, essentially diet quality, physical activity, and help college students manage stress within their first year of college. On the right, you'll see a wellness report card. So throughout the project, students, both within the courses that we'll talk about, as well as the actual participants, were given opportunities to kind of check in with themselves and see how they were doing. There were 2 courses developed within the framework of this study. The first was a 3-credit course for undergraduate students titled Social Marketing and Environmental Interventions. This was truly an active learning experience course where students came together to evaluate essentially their own campus, discuss what were some of the barriers and the motivations for healthy eating, living an active life, and other health behaviors of college students, and then develop intervention activities to target and support students in living a more active and healthful life on a college campus. So this 3-credit course we taught together, and Dr. Kattelmann will talk about that a bit. So the 4 intervention schools all advertised this, as well as the next course we'll discuss, enrolled students in the course, and then co-taught this 3-credit course one semester. Throughout the semester, we had multiple days where the classes would get together over Zoom. This was pre-COVID. We figured out how to use Zoom pre-COVID, and worked together and reported back from each campus how things were going, and kind of working simultaneously and discussing what might be different from one campus to another. Ultimately, this class, so a 16-week course over a semester, ultimately culminated in a retreat at the University of Tennessee, where we brought the students from each of these classes together. And Dr. Kattelmann will talk about that. So that would be, something, having the resources to bring college students from 4 different campuses together is a lot. It's a big expense, but a big budget item. But now, with all of the different technologies that we're comfortable using, there would be much more economical ways to do that same thing. Our other course was a peer mentoring for health course. So as part of the intervention, one of the ideas that came about was matching incoming freshmen with upperclassmen students to serve as a peer mentor for health. So in doing that, we also needed to then develop this course to train students to serve as peer mentors. We had to advertise and recruit enough peer mentors across all of the campuses to serve as peer mentors, and then ultimately match them with participants that enrolled in the project. So here, the goal of the peer mentoring course was really to make sure that our peer mentors had an evidence-based understanding of a broad range of health topics, from nutrition, physical activity, stress, and other mental health aspects of the students, and then make sure that they were well connected on campus for referrals as appropriate for students, feeling comfortable talking about these different topics with students, knowing when to ask for help from faculty or from other facilitators on campus if there were times of need. So we had, and we worked, as I mentioned, true CBPR. We worked very hard and had the luxury of a semester of getting organized to really build an invested and capable team. For instance, I mentioned in the 3-credit course, this was a 3-credit course that we all had. Here at University of Florida, we had 30 students, with undergraduate students within that class. At the same time, I was able to recruit 5 graduate students from across campus to serve as teaching assistants within that class. So I had some upperclassmen help really to help organize, lead discussions, breakout groups that really made that class successful. So thinking of how could this work, on another campus, what kind of resources do I need? Pulling in other people, other leaders on campus, and giving them those experiences to lead was really crucial for us. For each of the classes, we required an application. So we were looking for students that were highly likely to follow through with their commitments. So not just in participating in the class, but then following through with delivering the activities that they developed afterwards. For the peer mentors, not only taking the 1-credit peer mentor course, but then actually following through with serving as a dedicated peer mentor afterwards. So we required all students to apply to essentially enroll in those classes. We all agreed upon some basic minimum requirements, such as GPAs, if they needed a prerequisite, and really that they had available time. But they all had to meet with us one-on-one for approval. We talked then about, what really would they bring to the project? Why do they want to be involved? Other commitments that they may have already made, such as, to campus organizations. Maybe they're working in research or have a job. How are they going to manage that? So really talking them through, what's your semester like? The semester you're taking the course, but beyond that as well. So for thinking of campus health promotion, it's an ongoing commitment. How did we find all these students? We did lots of activities across campus to raise awareness about what we were hoping to do, get students excited about different opportunities. Here you can see a student, we had a pop-up event, take a selfie with a healthy. We had banners around campus that we were looking for sophomores, juniors, and graduate students to serve, to take those courses and then serve as peer mentors and campus leaders in promoting health change. We had social media flyers that we asked advisors, particularly in departments that we thought may have a foundation of knowledge that would be important for the project, such as dietetics, nutritional science, exercise physiology, health education and behavior, psychology, other departments where we likely would find interested, dedicated, and students with some foundational knowledge wanting to get involved. And through those classes, as I mentioned in the social marketing and environmental interventions course, beyond working in our small groups and our classes on our own campuses, we also provided opportunities for students to interact with the other universities, really building engagement and commitment that they were part of something much bigger. And those opportunities to provide feedback and kind of ongoing input. And this is us here at UF as we are about to take off for that summit at University of Tennessee. At the summit, which again, this could be held virtually, it could be a summit within a class as, evaluating or developing health promotion activities on your campus. The summit could be a culmination within the semester of different groups of students reporting back, for instance. But you can see the quote here from one of our students after presenting at the summit. Process has been very different than they envisioned. More active in the class and excited for the interventions. They became very invested, bonded with their team, and had lots of excitement and were ready about delivering their upcoming plans. We had lots of outreach and engagement as well. So for instance, many universities have a collegiate 4-H organization. So we also reached out to appropriate organizations across campus to try to partner in different activities. Collegiate 4-H was one of those clubs. Also, the Culinary Arts Student Union we partnered with, as well as our Food Science and Human Nutrition Club here at UF for activities and really building that community support, motivation, activities, and listening to what the college community was interested in, what they saw as their barriers and solutions. We were able to participate in the National Collegiate 4-H Conference even that year. And this is our peer mentors from University of Florida. So the peer mentoring class I didn't mention was all online. So our 3-credit social marketing class was in person, but our peer mentoring 1-credit course was online. So we also then created some activities and opportunities for students together to meet in person and really, again, build their excitement and engagement that they may not have had just working together online. Within our budget, of course, we had now enough money to buy everyone t-shirts, which not everyone would have, but providing those social opportunities, which could be done very much on a budget to get together, meet each other, and build that sense of community and value. How did it all go? At the time of doing this project, I was an assistant professor, very nervous about tenure and promotion at that point. And so I was anxious of how these 2 courses would go and what students thought of them, because they were so different than the typical college course that I was used to teaching. So here, the social marketing and environmental interventions class, the 30 students on 3 credits. Here's the mean. So on a scale of 1 to 5, essentially, the amount learned, the students reported a 4.83 mean on their evaluation for the amount that they learned. I was so excited to see that because we really delved into lots of different topics regarding health behaviors and health promotion. And the educational value also 4.8. So very pleased with what the students perceived that they got out of participating in the class. For peer mentoring, not quite as high, but really, really, really commendable. So the amount learned, again, 4.4, the educational value, 4.6. Such a great experience, and I think that bringing those students together occasionally in the live groups, we had a couple get-togethers around the holidays that semester, that really built the commitment and helped build passion within students also for what they would be doing and why it was important that they were invested. And then students really led the way in recruiting participants ultimately. At University of Florida, we were the largest university on the intervention side of the project. So our goal was to enroll 300 participants, and we did, 300 freshmen. We did it. We tracked our recruitment, kept a little ladder going of how our progress went as the apple went up the steps, as our recruitment number increased. And so students even felt invested in recruiting participants so that they would have someone to mentor as a peer mentor, for instance. So they were involved and committed in every aspect of the coursework and the projects. Here's some pictures from some of the activities that the students developed, some of the social marketing messages, some really silly things. You can see over here the sign, pick fruits and vegetables, not your nose, just really kind of silly things. But lots of activities, tastings, quick and easy recipes, pop-up events around campus, opportunities to be physically active, yoga on the lawn, those kinds of activities, and getting people excited and engaged and participating and providing education along the way. We had lots of others, kind of lower budget things, for instance, stadiums, doing stadium workout, promoting that, encouraging people to come and participate, peer mentors and their matched first-year students to come out and work out together at the stadium and socialize with the group. We also had the students essentially developed 16 weeks of themed activities. One of the weeks was a positivity week, where all of the students took the time to really be thankful and consider what was important in their life, what were their values, and really to encourage other people to do the same thing. We have a tunnel where graffiti is allowed on campus, and so that was one of the activities the students did for that week, was painting a big area of the tunnel and then providing opportunities for anyone walking by even to come and paint a message of positivity on the tunnel. And it made it into the student newspaper. So outreach there reached many more students of what was happening by being able to be seen in the student newspaper. In doing that, because this was an AFRI and because we are, college researchers also, we also did a lot of evaluations along the way and took the time to understand what was happening within our classes that was leading to learning and engagement. And so here's a list of some of our publications from the project that are directly related to the classes. So now I'm going to turn it over to Dr. Kattelmann to talk more about those outcomes.
Right. So the outcomes that I'm going to be sharing are during that SMEI class, we created transcripts. So what I'm going to be sharing is the outcome that came from those students who in that SMEI class. And by the way, this is, so we call this community-based participatory research at the time. Since that time, I've learned there's this category called implementation science. And when I started looking at how implementation science was defined, this project really also meets that definition of implementation science. I mean, we called it CBPR, that's still CBPR in the community. But when you look at all of the things that we did to develop an intervention we didn't develop an intervention, we incorporated students of that age group to help develop the intervention so that we can disseminate it and that it stays. It's really called implementation science. And so the first slide is just the objectives of FRUVS, which is what Anne has already covered. And that is to explore the health-related knowledge, beliefs, and attitudes of those college students and to better understand approaches for college wellness programs that they should consider. And we use CBPR, okay, or implementation science. So you can, and Anne is going to have to do the next slide. She's got it on her computer, so you're going to hear me say next slide. So this is a little bit about the background of the implementation science or the background of the intervention of the outcomes. So this is specifically about that SMEI class, which Ann talked about the recruitment that occurred on her campus, and we recruited similarly on my campus, and all the other, both campuses did too. But I do want to say this occurred before everybody was had Zoom. Like today, we would do it really and just drop right into it because everybody's got Zoom since COVID. This was pre-COVID. And so we were all really concerned about, can we develop a class that we can teach across universities at the same time and interact? And we did. So if one of the interventions or one of the schools couldn't participate every time, so it was pre-recorded so they could share the information that was shared and listen to the same information, and that way the conversations that were collected were the same. So as we said, back up one. Yes, we had back up, there you are, thank you. So we had student researchers, and those were equal partners, and we had 102 total. Of course, the University of Florida was the largest university in the area, with Ann having 30, and the remaining were divided among the other 3 schools. And we were all 4 land-grant institutions. And I said it was a hybrid course, so taught online and then partially in class. All right, next slide. And first, the student researchers took part in 5 class discussions that were audio and video recorded, and they discussed the definition of health, changing behavior, social marketing, changes on campus to support wellness, and the most important messages to get the messages across. Prior to doing each of these areas, though, the students were introduced to, or not introduced, they were provided with lectures on each of the topics so that they would have a good basis of what it would mean to how health is defined, or what in those areas. And then each of the universities had their classes discuss among them what was important. And that is the transcripts were captured and transcribed. So you can go on to the next slide. So the transcripts were captured and transcribed, and this is what I'm going to be reporting on. So this is the transcripts that came out of the class. This is the research component that came out of the class that helped develop the food intervention. So there were 20 transcripts over the 4 topics. And then one student who was not involved in the classes coded, and I coded the transcripts for themes. One student not involved in the class and a faculty coded the transcripts for themes. And then the transcripts were coded to consensus with discrepancies adjusted with third researcher to eliminate conflicts. You can go to the next slide, please. So what I'll be presenting are those themes that came from this SMEI class, all right? There were 4 components. So the 7 themes emerged, and they 4 described components of college wellness. And what it came out to be is what it means to be healthy, the importance of health, barriers and facilitators. And next slide. And then 3 themes emerged, suggested programming to support behavior, like what changes college wellness programs need to address, approaches that could be done to change behavior, and approaches to get the college student attention, which were kind of interesting. So next slide. So this is some of the things that came out of what it means to be healthy. So their definition, this is among these 20 transcripts and these 100 so students, to exercise regularly, limit sedentary time, consuming a variety of nutrients and healthy foods, adequate sleep, ability to manage stress and emotions, not abusing substances. And the one thing that was kind of interesting that came out is to what it means to be healthy, it was a chore to maintain healthy. So some of the students thought that just by trying to be healthy, it was a chore. So that means that it needs to be fun. So the importance of health, under that, why was it important to be healthy? They described physical benefits, mental benefits, financial benefits, and environmental benefits. And I don't know if you noticed when Anne was talking about, we did a wellness card, and that wellness card that was developed for the intervention had the students assess their physical activity, their nutrition, their stress management, and their sleep. And that came from some of these topics that the students in the SMEI course thought were important. All right, next slide, please. Some of the barriers that were addressed, and these probably aren't new to you. I mean, this morning I was in one of the round tables, and see, these are some of the same barriers that are still around in today. And some of the barriers to health that were identified by the students were easy access to unhealthy foods, and again, lack of health foods, so kind of the same thing. Misinformation from the media about food, marketing, lack of cooking skills, taste. Of course, as Anne was saying, taste is still the most important thing. So it's your preference for the type of food that can be a barrier. Stress, peer pressure, and I heard that again in the roundtable that I was a part of this morning. Lack of sidewalks, lack of time, finances, and conflicting priorities. And these were coming from college students. So, and some of the facilitators, which to help for facilitators of healthy behaviors, were having healthy friends. And again, I heard that this morning, so that hasn't changed. Access to gyms or access to places where they could have physical activity. Access to healthy foods. Access to health education. Implementing a daily routine. And finding physical and mental balance. So that's back to that managing time and stress management. So the challenges or changes that college wellness programs should address, and these are things that the students suggested, were to work on increasing the healthy food options on campus, decrease the cost of healthy foods or ensure they're affordable, limit the unhealthy food options. I'm not sure we can do that in our country, but this came from the students. Increase in health education, which refers back to what they felt would help with the healthy. Promote truthful marketing. Promote health-related organizations. Greater emphasis on mental health. And conveniently located sidewalks. Although some of these are easier to obtain than others. I'm not sure that it would work for me to go out and start pouring sidewalks across campus, but I just want to remind you that these were things that the students thought would be important. Okay, next slide. Oops, we must be frozen. Oh, thank you. So the approaches for the wellness programs, so this is what they thought that the wellness programs could do, would be provide health education, for example, workout and cooking classes, some things that they could implement. Provide increased support opportunities, for example, support social environments where their friends could help. And that's actually the peer mentoring class was to help do some of that. Accommodate student schedules, and I'm not quite sure what they mean by that, but I think their intent is that the activities should be available when the students have their free time. All right, next slide. And then these were the approaches to grab the students' attentions. These were the ideas that the students had that would help grab a student's attention, with all of the media and things happening. So they suggested having celebrity speakers on campus, promoting club events around the different activities, having cooking classes, having farmers markets on their campus, so they were close to the campus, having the events free, and that's back to having affordable events, having themed events. To me, that's kind of related to the celebrity speakers, and again, schedule when convenient for students. So that's back to having things available when the students are available. All right. So the conclusions from this SMEI class: this information can be used by the college administrators and the champions to promote and develop wellness opportunities on campus. And this information actually was used for the intervention, the FRUIT intervention. The strength of the study was that it came from 4 geographically distinct universities: University of Florida, University of Tennessee, West Virginia University, and South Dakota State University. There are some limitations. This is a convenient sample, and as Anne was saying, how these students were recruited. So these were students that would more than likely be interested in health or marketing. I know that one of the students I had in my class, their background was marketing. Another student I had, their background was in sustainable ag. So they came from a variety of backgrounds, but again, it was a convenient sample. Okay, next slide. So after the semester-long SMEI class to gather the health-related knowledge, beliefs, and attitudes of these college students, the students and researchers gathered at that summit to determine the social marketing events and activities that would be included in that campus-wide intervention. And that's what Anne was showing you some of the pictures. But they had the culmination, and then the activities and the social marketing were developed by students for students. So, all right. I think I'm going to skip this outcome from the peer mentoring class because Anne pretty much covered that. We did have a peer mentoring class that we talked about on each of our campuses, and to train peer mentors on how to connect with students. It's upper level students to connect with freshman students. And I know it made it, or I should say it was apparent on my campus because they do have mentoring, but they didn't necessarily have health mentoring. But the person who in the student affairs who was tracking mentoring reached out to me and wanted to know more information about it and wanted to track it. So I think it did make a difference, and we were on my campus anyway, where they knew that we were there. But we did train the peer mentors and train them on resources so if they came across a situation which they weren't comfortable with, that they had resources to reach out to refer that student or to refer for help. So they weren't there by themselves. And we did provide limitations on how they were to communicate. So anyway, next slide. So these were the course topics for the peer mentoring that we talked about and provided for them. So, yeah, thank you. I guess this comes to time for Anne. Do you need anything, would you like to add anything to what I was mumbling, or any questions?
No, one of the things I had forgotten. So for you guys, if you happen to attend the audits presentation that I gave this morning about our environmental audits, in that there was, I briefly touched on a systematic review that was just published this year about the food environment and nutrition, food choices of college students. And one of the findings that came out of that was misinformation that students don't necessarily know how to interpret marketing of different products and view products that aren't necessarily healthful as healthful, largely because of marketing, I imagine. But one of those topics that came out of the class, Kendra, that I had kind of forgotten was the truth in marketing.
Yeah. Well, and so based on this class and the outcome from it, and the idea that they wanted more healthy food on campus. And this also was discussed this morning in the roundtable that I happened to be in. When we talked to the food service providers on campus there, and when we did some of those environmental audits, we had a lot of healthy food on campus. The students just didn't know where it was. So based on this SMEI class and the FRUVed intervention, I did develop some healthy campus tours and recruited students from our freshman class to do campus tours or healthy campus food tours. We trained students in conjunction with the wellness center and the food provider the company that provides food on campus, and provided, we had a script, and they took them, this was of course pre-COVID, they had little tours across campus. It took about an hour, and then the person leading it showed them, they went to each of the places and they discussed healthier options in those places. And we have a lot of kiosk and franchise eating, so we were able to go to each of those and talk about what would be a healthier option from this kiosk or franchise eating, as well as we have a dining facility where it's the dining facility with a large selection. They could go in and talk about those selections. Mm-hmm. So that came from the class and from the students saying that there weren't healthy options. But in the roundtable this morning, one of the comments from the roundtable was there are healthy foods on campus, but there's a perception that there aren't healthy foods on campus. Healthy foods. Students just didn't know where to access them. Mm-hmm. So.
We have a question in the Q&A if the online peer mentoring course is available to other institutions. We don't have it, so it's it in itself, and this rendition is not ongoing currently. But if you'd like to email me, I would be more than happy to share the syllabus and any materials from the course for sure.
Yeah.
But on that note, this in the beginning presented this as, we were able to do so much in a short period of time because we had the resources and the support of an AFRI grant. But some of the things that, like Kendra was saying, of what has she carried on at South Dakota State, I kind of, just before this project started, had already developed a course at UF called Preventative Health Experience. And based on both the SMEI course and the peer mentoring course, I really revamped that preventative health experience course to incorporate many aspects, mostly the collaborative components of both of those courses into that preventative health experience course, which is a 2-credit course without any prerequisites. I get lots of health majors, meaning nutrition, health education, psychology majors, but also, math and business majors that are just interested in their own health and those kinds of topics in general. But we always have some kind of collaborative project within that. This year, for instance, they worked in teams to develop many social marketing campaigns similarly to promote some health behavior among college students throughout the semester.
Yeah, the advantage of having it grant funded is that I don't know what happened on your institution, but because it was grant funded, I could offer the class as a reduced tuition class because the instructor of record the salary was covered by the grant, which was me. but that was, I had to request that. now, without grant funding, I wouldn't be able to do that. Were there any other questions?
I'm going to put my email in I should put it in the chat if anybody would like the syllabus or other materials from the course.
We all had the same syllabus because we used the same syllabus and same materials for training.
One more question, asking if you have compared your results from the two institutions.
No, we did not compare the results between the institutions. The difference is because it was conducted as one group, we didn't separate them by institution. We combined the results into one transcript, but we could, but we didn't at the time. Because the intent was to look at it, a priori was to look at it by the class.
One of the other outputs from the SMEI class and from the project as a whole is a toolkit of the activities. And I can't remember which session.
That it can be found when you go to the agenda, there's a link for all of the tools used, and it's under it's a 100-page document under the wellness. Let me see, I should go back. I looked at it. It is the Get Proved manual that has all of the interventions in it. And there is a link to that. So let me go back to the agenda and see if I can find it.
While you're looking for that, I just want to thank you both for presenting that wonderful session and providing all these great tools for our participants today. If there are any other comments or questions, one last call for questions. Otherwise, the next session will start in the main room at 3:15, and you can navigate back to that main room by clicking on the box in the top right of your screen once we end the presentation.
And it's the college wellness. I'm putting the direct link to the toolkit, but it's under the college wellness. It's in the link under the agenda, under the sign up about tools for this campus or for this for the conference. So,
thank you so much. Great.
Thank you, Amanda. We appreciate it.
Yeah, thank you.
Thank you.